Welcome back to McLaren Port Huron's Today's Health Program. Today we're talking about trauma services, and joining me now is Vice President of Nursing, Christie Sansom. Christie, thank you for joining us today.
Thank you for having me.
Now, I understand that McLaren Port Huron is the only hospital designated as a Level 3 trauma center in the Blue Water area. Can you tell us more about this designation?
Absolutely. We are very excited to be the area's only designated Level 3 trauma center. It's a designation that our hospital as a team has worked together with for many years to ensure that we're following national guidelines, to ensure that we're giving evidence-based care to our patients and their families during a horrific event as a trauma.
Now, tell us exactly what this trauma program means to our patients in our community.
The national guidelines that are set forth, and also the state uses the same guidelines, make sure that we are following evidence-based protocols. So all the way from a patient that has an accident in the community and is cared for by our EMS personnel to when they come into the hospital, it ensures that we are following all the proper protocols and procedures to ensure that they have the best outcome.
Now, the hospital has previously always provided 24-hour emergency services. How is the care different now that they're a designated trauma program?
Well, some of the things that we looked at when we decided that we wanted to pursue this, this designation is to look at the amount of training that our staff receive, to look at our call schedule to ensure that we're able to very quickly respond to patients in our community that have had a trauma. In addition to that, we have additional certifications for our physicians, for our nurses that are in our emergency center, also the nurses within our operating room, our PACU unit. All of those pieces actually touch a trauma patient, so when we look at it from a national level and you look at those guidelines, we want to ensure that we're not only meeting those pieces for our community, but we're actually exceeding them.
So it sounds like care for the patient is actually much enhanced from what it was before.
It absolutely is enhanced.
Now, aside from the emergency center staff, what other staff throughout the hospital are involved in the care of a trauma patient?
Well, when a trauma patient arrives to our facility, it's not just care that they receive with an emergency room with a nurse. You have you have a trauma surgeon that's involved in the care. You have the emergency room physician. You have emergency room nurses. You have your lab that attends and radiology that comes. We have spiritual care that can actually be available if that's something that's needed at the time as well. It's very much a team effort. And then if it's a patient that stays within McLaren Port Huron, then they go to the ICU, then it's care that they receive there as well.
Now, most trauma patients arrive to the hospital by ambulance. So what is happening kind of behind the scenes back at the hospital when we hear that an ambulance is coming in with a trauma patient?
Well, the EMS providers actually radio in a report to the emergency room to say that this is the scenario that we have going on with a patient. And after that is done, then when the patient arrives, the trauma team is ready. You have your emergency room physician meeting the patient there. You have your specialty trained emergency room nurses there. You have the whole team, nurse aides. You have your CAT scan ready for when that patient might possibly have to have that completed. So there's a number of things that happen in anticipation so that the minute the patient actually comes through the door, that the entire team is ready to receive that patient.
Wow, that's great care for our patients. Christie, this has been great information. Thank you for joining us today.
Thank you for having me.
Stay with us. We'll be back after this message.